The NHL's plan is very strong because it is located in Canada, which is easier than restarting any sport in the U.S.
The players were back on the ice Monday, but the NHL's priority remains icing out COVID-19. And given concerns in other pro leagues, including game postponements in Major League Soccer, one epidemiologist reminds us that proper quarantining in hub cities is the most important step.
That's the real danger time of missing a case that somebody picks up just before they leave and then importing it into the bubble.
If the NHL gets through the early days mostly unscathed, the team bubbles should help to clamp down further risk.
You're really limiting travel and you're severely restricting contacts between people inside the NHL and outside of it, meaning it's harder for the virus to get in. And you're doing very frequent, in the NHL's case, daily testing.
Binney doesn't anticipate issues with arena or service staff. They too are subject to regular testing and protocols. Low Canadian case numbers also help, but the plan could get tripped up if someone gets cabin fever.
I would be a little more worried about any players or staff somehow managing to sneak out of the bubble for like a night at a bar or something like that.
The NHL plans to isolate players who test positive, requiring 2 negative results before returning. Their close contacts will also be tested, but many fans are wondering how many positive tests would truly sound the alarm.
What I'm looking out for is 3 to 4 cases on a team in rapid succession. That would suggest a cluster of cases that may be an outbreak on a team. And that's something where you really need to shut that team down very quickly, figure out what's going on.
Ultimately, Binney believes the NHL's plan is the soundest among major sports and is optimistic that any new cases are unlikely to lead to issues for the general public.
As long as you're being really strict, especially during those first couple of weeks after everybody arrives, my hope is that the threat to public health from an outbreak would be relatively low.
In Edmonton, Courtney Theriault, City News.